I think having a sort of a very welcoming environment wherever it is you're going, whether it be like a doctor's surgery or, even a gym or something, there's sort of a welcoming environment that you can sort of say, hey, people come up to you and say hello, and ask how you're doing. And even like the day call could be maybe welcoming too.
An important one for me is co-design. I think a healthcare service should involve women with disabilities in the design and maintenance of their services and involve them early. Why make a service for women with disabilities without involving and listening to women with disabilities? It's not going to be the right outcome.
And there are so many extra barriers to financial wellbeing and security that women with disabilities face. There's the higher cost of healthcare and of supporting a condition and a disability. There's the additional barriers to employment and education that have to be overcome. And as you said, having lived with your own body in that space of chronic illness or disability, it really is like you've got your own degree, because it is a full-time job in itself, and it should be recognised as another form of expertise, and it should be remunerated when that expertise is being utilised.
Yeah, it's not a tokenistic thing, it's not a checkbox. You actually listen and you're involved, they're part of the process, and it's going to be a much, much better result.
You can validate the experience that somebody's having and the challenges they're experiencing without being able to fix all the issues or even necessarily fully being able to understand it, which comes back to listening to what somebody's saying, accepting it as the truth, even if you can't find something on a test that backs it up, and maybe coming up with a few ideas with that woman on how you could reduce the impact based on their resources and supports, which means it's going to look different for everybody, even if it's the same issue.
It's also important that maybe if you don't have the answers, it's okay to say that you don't know, but you should validate the experience. If someone's experiencing pain and maybe you can't fix that, acknowledge their pain, talk about support and what those next steps might be.
It can't just be tokenistic, it needs to genuinely be involving women at every step of the process. And I think we can also work towards making workplaces more accessible by normalising flexibility, whether that's keeping some availability open to work from home arrangements or varying start and finish times to avoid peak hour travel, part-time hours, job share arrangements. There are many different ways that we can make sure workplaces are staying accessible at all levels.
Absolutely, and not looking at that as a burden, it actually can be an asset. I think it's really important to normalise flexibility in a workplace so that it is accessible for women with disabilities, and there are boundaries and things in place that can make being in a healthcare setting and working in a healthcare setting accessible and achievable.
And making sure you actually include the staff member with disability in everything. If there's a meeting, include the staff member, don't exclude them, because that means they're cut out of the loop and they don't know what's going on in the project.
And if you're not sure how to include them, ask, how can we make this more accessible?
Absolutely, Kate.